our girl Rachel from Public Health's Echo Team. We try and get the Echo Team on every week. Good morning, Rachel.
Good morning, Chris and Sabrina. How are you guys?
Good. Long time no hear.
Long time no here.
Yeah,
but I'm really glad to be back and to share some basic information. Again, we are at the Eco Team, and our role is really to impart to the community or to our listeners the importance of prevention and how we are doing right now in our prevention as we fight this COVID-19. And for this, Sabrina, how are you guys doing?
We're here. We're, keeping on.
Yeah, I hope everyone, everyone is doing great.
How about you? How about you, Rachel? How are you doing?
Really, really, really great. Now we're back in our usual work now.
Okay.
Yeah, we're tying into the transition into what we are doing before. So that's why this time we just have to do it lightly. But I'm glad to be back to my job.
How's Francis?
And also Francis will be a busy time for them right now because they are from the Department of Environmental Health. So they're kicking off.
Oh yeah, especially considering the possibility that the restaurants might be opening.
Yes, that's why. So I might be giving about DAH and what they'll be doing in the next weeks or days.
Okay.
As they transition into their opening also.
Right. So what do you have for us now, Rachel?
Of course, Chris, as usual, we are now into pandemic condition of readiness and some restriction, as we know, were being lifted gradually. Certain businesses, non-government or government organization became operational, but it is, of course, it is imperative for us to take precautionary measures to slow the possible spread of COVID-19. And I will not be tired in saying this continuously to remind the listeners of our island to at least continue what we are, amazing job that we are doing, that we flatten the curve of this COVID-19. In the past days, that there have been no cases has been reported, and at least the island has tested at least nearly 5,000 people in our island, and we only have 54 cases, 5 deaths, and that's really an amazing job for us. So as for us, we are still continuing to let everybody out there to continue practice the healthy habits that we have, the preventive measures that we have, which is continue to stay home if you are sick. If you don't have anything out there to go out, stay home. And of course, continue the practice of social distancing, which is keeping a minimum of 6 feet between yourself and others wherever you are, be in public places, groceries, supermarkets, take-out establishment, laundromat, convenience stores, going to the malls, going to the banks. And of course, now that you are going back to work in your workplace, to continue practicing it. And of course, when you see your friends, avoid hugging or embracing. Just say hi, just say hi, and then so that to avoid the spread again. And of course, wearing face masks or face coverings when you are in public areas. And of course, in the workplace, since we are opening, since some of the businesses has been operational, to adhere to the respective business protocols in place for protection for COVID-19. And what are these? Meaning the minimum pandemic workplace operational requirements. And I may say, what are these? This is, of course, wearing of face masks, and of course, develop communication of social distancing policies. Of course, like separating desk and workstation from one another at least 6 feet from each other. Of course, modifying your workstation, like the cubicles that you have been trying to work in, and of course, consider limit in-person interaction and physical contacts. So for those businesses that's been doing a lot of people coming in, like convenience stores, laundromats, banks. So they should limit people that's coming in. And of course, we can see this by having sign of 6 feet from a distance when you go inside a certain establishment. That's a good sign that they are really practicing that. And of course, not allowing person to come in without face covering or face.
Rachel?
Yeah, she's disconnected.
I had nothing to do with that,
Sure,
Sabrina. I'm over. I didn't touch anything.
Mm-hmm.
I didn't even
You
look
looked
at any.
at the button. That's
looked-
what you
okay,
looked at.
I did look at the button. You're right about that. Yeah, so we'll try and get Rachel on. I don't know what's going on here. A lot of great information, though, coming out from Public Health's ECHO team. And like Rachel said, they're all kind of back at work doing their regular jobs.
Mm-hmm.
And so we definitely thank her for taking the time.